look at our agenda, we'll be joined by our esteemed instructor, Dr. Pierre Bouhanna, who will deliver a comprehensive presentation for about 45 minutes, followed by a 15-minute Q&A session. So please use the Q&A button on the bottom of your Zoom screen to submit your questions, as the attendees will remain muted throughout our session today. In total, our webinar is expected to last around 1 hour. And now I'd like to introduce our instructor, Dr. Bouhanna, our esteemed dermatologist specialized in hair transplantation. Dr. Pierre Bouhanna specializes exclusively in surgical dermatology focused on the scalp. He serves as a consultant at the Paris Saint-Louis Hospital, Sabro Center, and is the director of the University Hospital Pitié-Salpêtrière in Paris. Notable publications from Dr. Bouhanna include the phototrichogram, multifactorial classification, and FUL unshaven long hair FUT technique. He has pioneered distinct transplantation methods for various hair types, with a focus on African and Asian origins, and is actively engaged in ongoing research involving stem cells, growth factors, and hair restoration for cancer patients. In 2015, he received the Platinum Award from the ISHRS, recognizing him as one of...
It's a pleasure to discuss today with all of you. It's for me very important to explain this topic today, because I think that for all hair transplant surgeons, it's the most important when they are faced to their patient. So we will discuss about clinical and trichoscopic assessment in hair transplantation, and I will try to give some examples to develop exactly the meaning of each procedure. Next. Well, for all of us, when we are doing a hair transplantation, the goal is to have all the keys to get a successful surgery. And for that, when you are faced to a male patient or a female patient, first you have to do an appropriate candidate selection. What is the most important in this case is the clinical diagnosis. And during the clinical diagnosis, you will first know exactly when the hair loss and the baldness has occurred, and also you will know when in the mind of the patient he is sought to do a hair transplant. You will ask also to him what are the heredity of the baldness in his family, and to see if it's part of father or mother, grandfather, and all. With that, you can have an idea of the eventual transmission. Second, you will ask if he has some health problem, because sometimes health problem, or with the use when they take some medicine, they may have a hair loss, and it helps to you in the diagnosis. Third, when you ask some question, you have to know if, of course, if they smoke, and because when you are doing surgery, always we have to know that, but also what treatment they have tried for their hair loss and to treat the evolution of their baldness. And for that, they have many times used minoxidil, they have used finasteride, and also PRP, and many other technique or drugs or procedure like injection, mesotherapy, and all of that. When you have all this information, you have to see exactly, to do a perfect measurement of their scalp. Of course, before doing this, you see if they have any disease of the scalp, like scale, or like dandruff, like seborrhea, and if they treat or not that problem. But when they ask to you to do hair transplant, they need to know exactly what you will do for their baldness. And for that, I use the multifactorial classification I will develop to you later. In the multifactorial classification, I will collect a lot of parameters. For me, it's like when you collect information before doing a trip on a city or on a country. In a country, you collect all the information to succeed your trip. It's exactly the same. And after collecting these parameters, I use always a trichoscopic evaluation with TripColab and Trichoscade, Tricolab for diagnosis, Trichoscade for some measurements. After that, I will develop how to choose the most appropriate procedure for each patient, FUE or FUT or both. I complete with the necessity of always do a correct follow-up of your transplanted patient. Now it's easier than before to do this follow-up because for my patient, they come from various countries, and with video, it's very easy for me to know exactly the evolution of the scalp after hair transplantation. So actually, we use always daily Tricolab technique and FUE or FUT long hair or both. I insist to say that you have to handle both techniques, because if you do only one procedure, is like if you have one hand. The best is to have two hands and to use it. So for the indication, you will have a most appropriate choice if you learn both techniques. Next. So actually, we use two procedures which are well known. The FUE, follicular unit extraction. We use motor punch, and with punch from 0.7 to 0.9. And after a careful anesthesia, we harvest one by one each follicular unit. And for that, before we do a complete shaving, or if sufficient, we do a partial shaving. And in some case, when the density is very good and we don't need a lot of hair transplant, we don't do any shaving. The other procedure that we use is FUT, FUL. What it means? We